My name is Moses Chirwa. I'm a consultant gynecologist who just finished my recent training in India at Merck Healthcare, PVT, together with IRRH. So infertility is a big challenge, and it is a public health problem in Zambia. Estimates could be around 10 to 15%. It may not be that accurate, but those are the estimates. And what we've seen is in gyne outpatient department, these are patients who come for different types of conditions. At least 15 to 20% of those patients are due to fertility-related problems. Now, these women and men are definitely going through bigger problems that sometimes society overlook. Families definitely don't feel to be complete when there's a child who is not in the family, and people get victimized, they get bullied, they get mocked that they're unable to have a child. Even calling individuals who do not have children all sorts of funny names. We do have our own local names for barren women. You see the term barren in our own local languages. It's there. People are called Dingomwa, and whatever they do, whenever they pick up even just simple arguments with anyone else, people always tell them, "You, what can you tell me? A woman who doesn't have a child, you are not a woman enough." It's like going through childbearing, having a child, raising a child. That's what others consider now you are a woman. So this training basically has now brought a clinician to be closer to the women. Way back, these women would need sometimes to travel thousands of kilometers. Some probably would need to go outside the country to access somebody who can offer that high level of specialized treatment in infertility. Others, like where I stay, Chipata, I'm basically like the one now who is now going to be spearheading fertility treatment. It means the people in that region will not need to be moving long distances, at least for a number of things that we should be able to do there, which way back I couldn't do. Like I said, follicular tracking, timed intercourse, IUI. Then subsequently, as we sit down, as we push for IVF and as we push for an embryologist, it means the people now that I save are going to have access to these advanced reproductive techniques, thanks to the Merck Foundation training that the Merck Foundation sponsored, training in advanced assisted reproductive techniques, which I underwent in India. Infertility has been one of a big neglected public health problem, also coupled with its stigma that comes with it. And one of the important things that I'm going to do is community engagement through radio, try and bring out this awareness on infertility. First and foremost, being infertile does not necessarily mean that somebody has to be ridiculed, somebody has to be mocked for that, no. I'll work with the local communities, local groups, because in obstetrics and gynecology, there are a number of times when we work with a community, sensitizing women on the need for a mother to deliver in a hospital setup or in a clinic. We'll take advantage of these same activities when we go out, and we'll bring in infertility, sensitize women, and more importantly, inform women that it's not the end of the road. Actually, treatment is there, because right now we can treat just about each, and just about almost anything has some kind of treatment, at least for fertility. Thank you. And in conclusion, I would love to thank Merck Foundation through the program of Make More Than a Mother. Words cannot be enough to say how so much grateful I am. Merck Foundation, too, on an individual basis, it has also greatly improved my clinical practice, which in itself gives me personal satisfaction. When I'm treating these women, I know now I'm doing the right thing and I'm doing things appropriate. And even where I may get one or two challenges, the institution where we trained from, we got their contact numbers and we are still able to communicate consultations here and there. All this is down thanks to Merck Foundation and the Make More Than a Mother program. Thank you.